I never really understand the pushback. I'm sure there's a litany of rebuttals they have for single payer, but I don't get it. Other than some people saying, well, we don't think it can be done, is really the only
Right.
pushback. Is there anything else that you've been hearing out there that people say when you post on Facebook? Because I know Facebook, you're going to have your trolls come out and have negative things to say. What, other than, well, this is Russia, this is like Russia. Like, other than that, is there anything of substance that they say?
They all try to push the tax increase. But again, it's easy to say, oh, but my taxes are going to go up. But then they never inform people that the money that's being taken out of your check every 2 weeks, or whatever money, wherever it's coming from, that you're paying for your insurance, you don't have to pay for anymore. That's what the tax is for. And in 100% of the cases, unless you're getting health insurance for free now, you will have more money in your pocket at the end of the year if you pay for insurance now than you'll have more money in your pocket under a single payer than you do under the health insurance company that we have now.
Now, and complete disclosure, right? When I worked for one huge company back in 2000. Well, actually before 2000, like in the late 90s, I worked for Bell Atlantic before it became Verizon. So that
Right.
tells you how old I am, right? But they've got like hundreds of thousands, I don't know how many employees. So they paid less for healthcare. Great, best healthcare on the planet, man. That at least that anybody I knew of was at the phone company, because they got that big pool and they could spread the cost out, and it was great. So I think maybe those people, I don't even know if those plans exist like that anymore, because that was a while ago, 15 years ago. But I think there's a possibility if you work for a huge corporation like that and you got a great deal somehow. But I think that's all gone away now with Obamacare. So that may be a
That's what I think I had previously under the hospital that I work for now. We had what they were referring to at the time as, I think, a Cadillac plan. They were pushing that. Like if you have a Cadillac health insurance plan, that's going to get taxed. But I think instead of keeping them and the employers paying a little bit extra for that Cadillac tax, everybody's just started offering crappy insurance.
Yeah.
High deductibles, high copays. I mean, I have somebody who was telling me they had to spend $2,500 out of pocket before insurance would cover anything. And that's after paying $500 a month for the insurance through the Obamacare exchange.
What the?
Yeah.
If you're going to rob me, bring a gun. At least show me the respect. You know what I mean? Like, break in the middle of the night, make it a real deal where, I'm traumatized, but this is really creepy that they're hijacking people like this, sticking you up, without you even knowing it, until it's time to go to the doctor.
Exactly. So, and that's exactly it, until it's time. And that's the thing, is that many people who were involved in this issue, who care about it the most, have had something happen to themselves or to their families where they've experienced truly how bad it can be. But again, for good, but millions of people in this country have no idea. They've never had any interaction with the healthcare system. So they sit back and go, why do I need this? Or why do I want my taxes to go up? And it's like, well, you know what? A 22-year-old was just brought into the ER, who just had a motorcycle accident or a car crash. You may not think you're going to get sick, but that doesn't mean you're not going to get hurt. That doesn't mean something's not going to happen to you. And that could be the end of everything you have. If you don't have insurance, or even if you have insurance now, you may not be able to afford the 30% of your $1 million bill. I mean, you spend a month in the hospital after a car crash, spend 2 weeks in the ICU, a week in step down, a week on a general medical floor, a couple weeks in rehab. You're looking at $1 million bill. And in some cases, you got insurance where you have to pay up to $5,000, and then they'll only cover up to $250, and then you're responsible for the rest. If you really dig into your health insurance policy and what it offers you and what it doesn't, I think every person listening to this show right now would be surprised.
It's worse than car insurance.
Car
insurance sucks. Yeah, car insurance sucks. But yeah, like this is I don't know what else to say, Jeff.
We just found out in Delaware a couple of days ago that our Obamacare exchange prices are going to go up 35% next year. 35%.
Wow.
And
no one's talking about Jeff. Why is no one talking about Jeff? I'm not playing, man. I have not heard this until you just said it out your mouth just a second ago. No
Yeah.
one's talking about this. Like,
Because
this
they
is
don't
front
look.
page. I'm tired of hearing about Trump. We need to hear about this.
Thank you. Thank you. Yeah, I agree. It's because this is the information they don't want you to know, because if you do know this information, then you vote outside of their duopoly. Then you don't look D or R anymore. You go anything else. Anything else.
Anything
I mean,
else? Fantastic, Jeff. Look, man, healthcare. If you could give some people advice who are struggling, I don't know if they're struggling, if, gosh, man, I don't even know where to go with this. Tell them something, Jeff. I'm kind of lost for words. A way to end it where you're giving some advice to people who are having some issues with their healthcare or they need help. Maybe I don't know.
I mean, the one thing that I'll say to people is the same thing that I guess I say to my friends when they call me looking for healthcare advice, or when I was in the ER talking to people. I understand that money's tight, and I understand that we all have to make sacrifices. I mean, I just was joking around with my dad the other day. I had to buy a new battery in my car, so I said I didn't go out and buy beer that night because I bought a battery. I wasn't planning on spending $150 that night. It wasn't in the budget, so something else has got to go. But when you're sick, don't wait. Even if you have to sacrifice something else, see your doctor. And if you don't have a primary care doctor, find one. That is the most, when you come into the hospital, that's one of the first things we ask you is, who's your primary care doctor? Because that sets up two things. Who have you been seeing? And who are you going to see when we're done taking care of you and you go home? Because we're not going to fix everything no matter how long you stay. You have to follow up with somebody. So please get a primary care doctor. A lot of them you can talk to. You can work out payment plans. You can work outside of insurance. A lot of them will talk to you. But just do the little bit of homework, the research that it takes, and find yourself a primary care doctor and see them before you come to the ER when at the first signs that you're sick, not when you feel like you're about to die.
Well, look, Jeff, man, it's been a pleasure, man, having you here, man. Thank you so much for coming on the show and educating people, and gave us a lot to think about. And I'm sure you're going to hear a lot of people from my show contacting you. Give it up for Jeff Day, y'all. You know it, man.
Hey, man.
All right, Jeff. Peace,
Talk
man.
to you later, Tim. Bye.
You got it, brother. Wow, guys, that's a great topic. And like I told you, this was a topic. I hope I lived up to it. You know, all of us need to be concerned with healthcare. I don't care. Like I said, I don't care where you're from. And this is an issue. And the way that Jeff ended it was perfect. Do what you got to do. Cut back what you got to cut back. Put them Jordans back. Tim, I ain't wearing no Jordans. Who are you talking to? Well, I don't know. Forget Netflix. I don't know what it is. Whatever it is for you, okay? Whatever it is for you. I don't know what I don't go out anymore. I don't do much of anything except work, but it's my choice. Okay? Because I feel guilty when I'm doing other stuff. It's like I'm so committed to what I'm doing, but if I wasted money on something, right? I would stop doing that in order to make sure I was healthy enough to be able to do what I love to do. So I just wish the same thing for you guys. And also, I mean, look, we're trying to go make this show all political, I'm sure, but politics always comes into play, especially when you talk about something like healthcare or another public goods, right? That's what this is, a public good, something that you should get. Healthcare should be a public good, sort of like water, okay? Something you should get just because you are here, not because you pay a certain amount of money. Same thing with schooling, roads access. You know, there's certain things that we should get that just should be. You're here. You're human. You're qualified. And stop using a person who has a sickness, maybe it be drug habit or alcoholism or some other situation, to try to use that to demonize people for you to not think of them as human beings who deserve these things. We all deserve it because we're all human beings. So once again, guys, thank you so much for tuning into the show tonight. Thanks for having my back. I got your back. And like I always say, don't you let nobody take your cornbread. Peace.